I currently work as the CEO of the National Health Council, which is an organization that was created by patient groups, for patient groups, 99 years ago. And you see the logos of many of those organizations in membership up here on the screen. We work only on systemic issues. So our focus is driving meaningful access and affordable access to high-value healthcare and driving innovation. Starting a couple of years ago, I began meeting with the CEOs of the patient groups and their board members and their volunteers. I did these listening sessions and I asked one question. I asked, what keeps you up at night? What is your most difficult challenge? And overwhelmingly, over and over again, I heard the same thing. I don't have affordable access to care. I think we have a huge opportunity to start to think differently. And we've heard a lot of folks talk about cultural change. And I can tell you, changing culture is probably the hardest thing you can do in an organization, in a country, in a society. It is not easy. And do not be mistaken. And I don't care if you live in a socialized system or not, health is big, big business. In the United States, it's approaching 20% of our economy. And there are many, many people who make their living in the health sector. And we want them to. But when it comes time to make changes, everybody points at everybody else and says, these changes would make sense, you change, but I can't change. It's not going to work for me. The entrenchment in culture is very difficult. Not going to be easy. And again, normally I would tell you don't do it. But I'm going to say this. I think we can actually impact culture. And I think there are a number of things happening in the environment. First, there's an absolute explosion of people with chronic conditions. When I started at the National Health Council, 30% of Americans had one or more chronic conditions. 15 years later, 60% of Americans have one or more chronic conditions. 30% of children. And that is not a US phenomenon. That is a global phenomenon. We're seeing people live longer, and we're seeing more and more people with chronic conditions. And it's a real challenge because we are invisible. Think about that. As people, we don't understand the magnitude of the numbers of people living with chronic conditions. We are completely invisible. We're not conditioned to talk about this, and we don't see it, even amongst our own community. And I think we need to start thinking about how we shift that. It's time for us to come out of our closet and have a conversation. Because at the end of the day, the magnitude of people with chronic conditions are driving healthcare costs. They're driving policy in every single country around the world. In the United States, 30% of the population drives 80 to 90% of all healthcare costs. 5% of the population drives 50% of the cost. We are the drivers of cost, and that is creating change in our health systems. And we need to be at the table as we think about how we shift that. It gives incredible opportunity for change. And I can tell you, when I started out in advocacy, I thought none of these complex chronic conditions were ever going to have cures. And we're now talking about therapies that you'll take once and you'll be cured. That's exciting. But it raises a lot of questions. If you can take a treatment and be cured and have 20 years or 30 years or 50 years of life where you are healthy, what is the value of that? creating incredible pressure on how we value health, how we value specific treatments, specific interventions. And oh, by the way, how are we going to pay for that? Everything in our system is predicated on, I'm going to take this treatment for the rest of my life. What happens when I only have to pay for it once? What is the value of that? How do we encourage future innovation? But how do we pay for that in the present? It's forcing us to think long-term in health. That is a very, very different perspective. We always think on the calendar year. That's how our governments are set up. That's how our insurance and payment programs are set up. How many of you experience your disease on a calendar basis? For me, it just keeps going, doesn't stop. It is challenging what we think of in health, and it's challenging all the ingrained systems. And most importantly, this concept of high value is dramatically displacing vested interests. Think about that for a moment. If I can take a shot once and never have to deal with colitis, never have to deal with the 2 medications I'm dealing with, never have to see that specialist, never end up in the emergency room, never be hospitalized, a whole bunch of people are not getting future payment. It's displacing current vested interests. And that is challenging our system and creates incredible opportunity for change. We still talk about data as if it was clinical trial data. And yet, all around us, data has been collected. The biggest disruption in health is not going to come from the health sector. I would submit to you it's going to come from retail. Think about that. Think of retailers like Amazon and CVS and other large retailers that are now buying delivery systems, insurance companies. Why do you think they're doing that? The reason they're doing that is they want to combine the data they have on you and your consumer behaviors with health data. And they're going to run that through algorithms. And their hope is that they can identify future outcomes that you will have and influence your behaviors. And we're already seeing models in Europe and the US where this data is being used. Again, not clinical data, but data about you and what you're doing in the environment, non-health data. And they're able to predict things about you and deliver interventions. And what we're seeing is an opportunity to move from population health and start to look at the individual and deliver care that's tailored to them. And what we're finding is we get much better outcomes at much lower costs. And it's debunking one of the greatest myths in health, and that is that patients want everything. Many in the healthcare sector are afraid to speak to us because they're afraid patients are going to tell them they need everything. And the reality is, and you all know this, we don't want everything, we want what works for us. It's very, very different. But it's challenging our old notions. With these trends that are undercutting some of the traditional foundations of health, we actually have an opportunity to change culture. The environment is on our side. You're seeing huge changes in the health sector, and health 5 years from now is going to look very different. We have an opportunity to develop a strategy that shifts culture. And it starts with coming together and being more clear about what our vision is. It doesn't need to be complicated. All we need is personalized help that helps us to live our best life.